One of the most frustrating things when it comes to dealing with osteoarthritis is when you have these joint pain flare-ups where it just seems like pain becomes so severe, sometimes randomly or sometimes after you've done too much the day before. There are lots of different triggers, but it is so important to know exactly what you can do in one of these pain flare-up situations that you're not going to be making the pain worse. And then you're not going to be prolonging this for a few more days. So I'm going to tell you my top 5 things that you can do to pull yourself out of a joint pain flare-up so you can get back to your daily routine and not have to be down for a few days and putting your life on hold. So without further ado, here we go. Okay, so we're talking all about joint pain flare-ups. Sometimes they have a reason why they happen. Maybe you did too much activity or ate some inflammatory foods or something like that. But sometimes they just kind of come on randomly, and that's just the name of the game of osteoarthritis. But the most important thing is knowing exactly what to do in order to decrease the pain and calm your joint down. Because when you have a joint flare-up, basically your joint is just really angry. And think about yourself. When you get really angry, there are things that you can do to help dissolve or dissipate the anger, and then you feel better. So same thing about your joints. We're just trying to make your joints less angry. So there are lots of things you can do, but I'm going to tell you my top 5 so we're not spinning our wheels trying to find something that works. So number 1 is actually listening to your body and resting. Now, I know I talk a ton about mobility and a ton about exercise and all kinds of different things, but it is important though to not be constantly overdoing it, to not constantly be moving. I have one woman who is dealing with some pain with bone-on-bone knee arthritis and honestly was contributing to some of her knee pain flare-ups because she just wasn't stopping. She was just pushing through the pain, whether if it was at work or just trying to do some exercises because she knew that those would help. But if you're constantly pushing through significant pain, that is going to trigger an arthritis flare-up. So one of the most important things that a lot of times we can actually lose sight of is just taking time to rest. Now, there are only a few instances where rest is going to be helpful with osteoarthritis, and honestly, one of them is during a pain flare-up. If you feel like you are just go, maybe the past couple of days or the past couple of weeks, sometimes just taking time to catch up on sleep, just taking time to let your joint relax can truly be helpful. Think of it just like self-care when we are feeling angry or we are feeling anxious or stressed or any of these negative emotions. Sometimes we just need to stop and just binge on Netflix or do something that's going to help pull us out of this and give us a little bit more relaxation. So number 1 is just finding ways that you can actually just listen to your body and give your joints a break. I would recommend this maybe a day or so and then getting back into some gentle movement. So we're not going to prolong this too much, but it can absolutely be helpful. Number 2 is going to be a gentle movement. So it's kind of piggybacking off the first one, but you do have to do some sort of movement because think of it like this. So your joint's getting really angry and you have all these inflammatory cells collecting. You have lots of trash kind of building up in your joint, for lack of a better metaphor. But getting that blood flow is going to help to take out the trash. And that's one way that I really like to think of it. But the key word here is gentle. So these are not exercises that are going to flare it up. We don't necessarily have to be doing squats or lunges or anything like that. It is honestly gentle movement. So a lot of seated things, a lot of exercises when you're laying down, just range of motion type things. Some stretches can actually be really helpful too. I do have a video here that's going to give you guidance on these simple movements. So keyword here is gentle movements, and just try to do them throughout the day, especially if you're spending, most of the day sitting or laying down, which happens when we have a joint pain flare-up because we don't really necessarily feel like doing much else. But just being cognizant of doing some gentle movement is going to be huge. I would say maybe, every hour or two is kind of a good rule of thumb. Sometimes people set alarms on their phones or whatever works for you, but trying to keep moving in a gentle way as much as possible. Now, number 3 is using pain control strategies. So there are typically 3 of them that usually work the best. So one of them is anti-inflammatories. So taking some of those NSAIDs, taking some of that medication for pain, whether it's Mobec or meloxicam, if you've been prescribed those, using things like Voltaren, topical ointments, sometimes CBD can work really well. Obviously, before you take any anti-inflammatory or any type of medication, you do want to make sure that you clear it with your doctor first, so you don't have any adverse side effects or anything like that. But those can be really helpful in these situations. Now, I know a lot of us are trying to avoid taking medications and not using it as a first step in pain control, but they can be very helpful in a situation of a joint pain flare-up. Now, one of the things I always encourage, though, is to use those in combination with, say, the first 2 things. So make sure you're resting if your body is craving it, and make sure you're doing some gentle movements. And then that way you can maximize the benefits of these anti-inflammatories. So you can also use heat or ice. Either one can help. I usually tell people it's kind of a personal preference which one you like better. Heat can induce relaxation, and then ice just kind of numbs those pain sensors. So sometimes heat can work better, but it's definitely a personal preference. So anti-inflammatories, ice, heat can be really helpful when you're in the thick of a joint pain flare-up and you just can't seem to get comfortable and pain just continues to persist. So those are okay as long as you are cleared from your doctor. Number 4 actually kind of piggybacks off this one because it is another pain relieving strategy but doesn't involve any medications, and that is actually compression. So when we think about compression is looking at ways that we can make our joint feel comfortable. So for us, when we're not feeling great, sometimes a hug or even just being held by someone can make us feel really good. So think of that with your joint too, that your joint just wants to be hugged. It just wants to have some of that compression that is going to make it feel good. So one of the ways you can do this is using compression sleeves. Now, there are a few different kinds, but there's a knee compression sleeve, which I actually have a blog post about that you can check out down below that has the top compression knee sleeves. Essentially, it's just a neoprene, stretchy, but tight sleeve that can really be helpful for pain control. Now, if you're looking for something, say, for your back, sometimes even just using a pillow and leaning up against that pillow is going to help to give it some compression. You can also, say if you're dealing with some hand pain where your hands are just really bothering you, you can get compression gloves, which I've actually had a lot of people that have had success with those. Essentially, they're just kind of really tight gloves that you wear that can be helpful. And they actually do make the same for your feet and ankles. So if your feet and ankles are the joint that's flaring up, those compression socks can be helpful. Even if you don't have those compression socks, even if you have some of those ACE wrap bandages just kind of laying around your house, that can be really helpful. Sometimes you can wrap those, say, around your hip, but it's going to be a little bit harder. But if you can wrap this around whatever painful area that's bothering you, that compression is really going to help. Now, you just want to make sure that they're not too tight where they're leaving like indents in your skin or impeding blood flow at all. So we want to make sure that they are fit properly. If you're using the ACE wraps, make sure they're tight, but again, make sure that they're not cutting off your circulation, causing some discoloration or anything like that, because that's going to be a little bit counterintuitive, but that compression can really help. Okay, and now number 5 is actually massage. So massage can be really, really helpful when you're in the thick of it with a joint pain flare-up. massage helps to bring blood flow to the area. So say, for example, your hip is bothering you. A lot of times your hip can bother you in your groin, or it can bother you in the back, kind of where in your buttocks. Massage can really be helpful. And it doesn't necessarily have to be done with your hands. You can use a soft tennis ball to kind of roll on whichever area is bothering you. You can use a lacrosse ball, but sometimes those can be a little bit hard. And same thing goes with foam rollers. Foam rollers can be helpful to bring blood flow to the area because, again, we're taking out that trash. So we're taking out those trash cells in our blood and then helping them to be replaced with some good ones. So foam rolling can also be helpful, but again, make sure it's not a really hard one. Make sure it's a softer one. So again, with any of these things, our goal is not to flare up pain. Our goal is to relieve it. So these sorts of things, whether it's actually hand massage that you can do yourself or someone else, you could go get a massage. We just don't know if deep tissue massage is going to be helpful in this situation, especially when you're a little bit more sensitive in a joint pain flare-up. But some light massage can be really helpful. There's all sorts of tools out there with different balls and different rollers and things like that, but some of that massage can be very helpful. But again, you want to make sure that you're not just flaring up and really kind of poking the bear. We don't want to do that. So make sure it feels good, and we don't want something super intense. Okay, so those are the 5 things to help you manage a joint pain flare-up. Now, when you pull out of this joint pain flare-up, one of the biggest things is really finding ways to prevent them, or doing things that you can help to get your arthritis on track. And there are 5 things that can help with that joint pain and really help to, 1, prevent these, but 2, just to keep your arthritis in line so we're not dealing with these flare-ups all the time. Well, the Ultimate Arthritis Guide is going to give you 5 things to start with in managing your arthritis pain in general in order to help you avoid surgery. And so if you want that, it is totally free and it's down below. It's a super quick read, but it just gets you started on the right path. And then from there, we have all sorts of things that can help you. But starting with that Ultimate Arthritis Guide is going to be one of the best things for you as far as naturally remedying your osteoarthritis. All right, thank you so much for watching. I hope that these joint pain flare-up tips were helpful. If they were, go ahead and hit that red subscribe button below so that way you can get updates when I do release new videos. Thanks for watching.